Hey, good afternoon, everyone. Hope you're having a great day. We're coming to you live from the Fox 2 newsroom right now. Yeah, during COVID, it isn't as full. So many people working from home right now because of the pandemic. And yes, the pandemic is what we're talking about. We're taking your questions. We've been asking on my personal Facebook page for the last few weeks, what questions do you have for doctors that you're just not hearing the answers to? Sometimes on the news or perhaps from your own experts in your own circles. And so we brought someone in who's a familiar face, Dr. Justin Skrzyynski with Beaumont. And Dr. Skrzyynski, it's good to see you. Thanks for joining us today. You've been watching these questions come in from Fox 2 viewers, and I know you've had a chance to look at many of them. So we're going to begin with some of these questions right from our viewers. You ready?
Yes, I'm ready.
All right. The first question comes to us from Eric. And Eric is asking the question, why do they have commercials about the vaccine and they don't say what the side effects are, like all the other drug and vaccine commercials? There are some people out there who believe that the vaccine is being treated like this, like it's there's no holes in it, there's no issues with it. What about any of the side effects or anything that you hear about when other things are advertised? Why aren't we hearing the same thing?
That's an excellent question. And, first of all, there probably should be, to be honest. I mean, it's a medication like any other. And to that extent, you should definitely be aware of the side effects. I will say that one of the best resources is to go online. There's a very robust reporting system in terms of all the vaccine side effects, all the vaccine untoward complications, et cetera. So online is going to be a great repository for that. I think one of the concerns that people have, and justifiably so, is that they feel like they're being beaten over the head with this message of get vaccinated, get vaccinated, get vaccinated. And people aren't hearing the opposite side of that. So in other words, what are the risks involved? What are the costs involved? Not only to getting the vaccine, but also to not being vaccinated. So I think that's a very fair question. And yeah, if you want to hear that sort of, rapid talk monologue at the end of the commercial, listing off all the myriad side effects, I don't think that's an unreasonable ask.
Yeah, and you certainly don't hear that a lot. I know that my wife and I were streaming a show just the other day, and every single break, without exception, was a vaccine ad that aired, and it was like 3 or 4 times, in a row, like 3 different ads, and then more of the show, 3 or 4 ads. So certainly there's been a push. Do you think, as a doctor, that for those who are hesitant, these ads, do you think they're helpful? Are they effective? Or are people listening to these ads?
That's another great question. Honestly, I don't know. But my a lot of my experience is going to be in the inpatient setting. So unfortunately, I see a lot of the opposite. I see a lot of the failures to be vaccinated, which is a very compelling argument from my standpoint to be vaccinated. In terms of, are you actually reaching people when you have these advertisements? That sort of remains to be seen. If you look at the vaccination rates, not only in Michigan, but sort of nationally, they've done this. They've basically sort of plateaued over time. So people are still getting vaccinated. I think when Omicron was surging, a lot more people felt that compelling reason to be vaccinated. But the problem is that in many ways, it's kind of diminishing returns at this point. When we had the vaccine, you have this huge segment of the population that lines up. People were paying money to jump the line, and now you literally can't pay people to be vaccinated. And then similar with boosters, you have this segment of the population very enthusiastic, very excited about it. You could say the same thing for kids being vaccinated, et cetera. You'll see the same phenomenon. But the problem is right now, it definitely is diminishing returns in terms of how many people are getting vaccinated versus how much resources we're pouring into that messaging.
Good answer. I mean, look, you can only kind of purport what you're hearing, what you're seeing. But I know that your concentration right now is mainly in what's going on at Beaumont at the hospital relative to the patients that you're seeing come in. So this next person has a pretty good question for you. Ron Williams is asking the question: why haven't you heard much about the flu? I mean, every other year, the flu was a big deal. We know that last year people were masking up more, so maybe that was a reason. But what about this year? What are we hearing about when it comes to the flu?
Yeah, that's kind of a curious phenomenon. As you said, last year we have a very obvious reason, which is that we have all these mitigation measures in place. So if you're trying to reduce the transmission of COVID, contagious respiratory virus, all those measures are going to translate over to flu, contagious respiratory virus. I can tell you that in the inpatient setting, we are pretty aggressive about testing for influenza as well as COVID. So we don't necessarily stop at COVID testing and say, well, that's it. I know that that's one of the concerns in the population. I know people say that COVID is overdiagnosed, or that issues that bring people into the hospital unrelated to the virus are still being diagnosed as COVID. I can assure you that in the inpatient setting, at least, we are testing for flu and we're simply not seeing it. So whether or not it's still the fact that we have a lot of mitigation measures, you do see a lot of mask use, you do see a lot of distancing. A lot of the large venues are not necessarily open the way they were in previous years. So those mitigation measures would be my guess as to why we're not seeing the big flu numbers.
Interesting. And you mentioned the masks in there. Talk a little bit about masking for a moment here. Kathy Smith, one of our Fox 2 viewers and Facebook users, says, asking, will we ever be able to stop wearing masks? What's your take on that? Is there a day in which you think there won't be any more masking at all?
Yes and no. Yes and no. That's a nuanced question, because I think there's going to be a segment of the population that's going to want to keep wearing them indefinitely, and justifiably so. You can certainly see the rationale for both sides of that. So let's say, fingers crossed, let's say we don't have another big surge. Let's say we don't have another major variant. What if we see COVID numbers decline into the summer and that's it? The question is, are masks still vital at that point? What's the upshot of wearing a mask at that point? Because, if masks are going to provide some mitigation, but the risk is so very low, not much benefit there, to be honest. But at the same time, you're going to have people who are still concerned about it, and justifiably so, and are going to continue to mask. So, from a medical standpoint, if you're asking, when is it going to be that the medical community is going to say, you know what, done with masks, that's it, no more need for them. From an official capacity, again, as long as there isn't another big surge or another variant of concern, I would almost anticipate throughout this year, maybe later into the year, you might see that recommendation as masks no longer being essential. But whether or not they're a good idea and whether or not they're still going to prevent some cases, that honestly might persist indefinitely.
So interesting. And, another interesting point about the whole masking and being in the open air and whatnot, we've seen all these ball games, all these football games in these outdoor stadiums where people have been able to, 40, 50,000, sometimes more, 60,000 people get together, and they're pretty close, and they're all screaming and yelling. And they always say that COVID spreads when you scream, yell, sneeze, cough, right? And so talk a little bit about that for a moment. If you're sitting at a football stadium or a concert venue, unmasked outdoors, we're not seeing the super spreader events outdoors, are we?
No, we're not. No, we're not. So outdoors is definitely going to be a safer bet regardless than indoors, unless you're indoors by yourself, for instance.
Right.
But outdoors is always going to be a safer bet. Much better ventilation. The problem is that, initially, remember going back a couple of years, you have that 6-foot rule, which doesn't really hold up so much now, because the idea was that if it's droplets, so basically the larger kind of particles of moisture that come out when you talk, yell, sing, shout, even just breathe, those will fall over time. So they've got a little bit of weight to them, and they're going to fall. The idea is that as they're sort of projected out, they're not going to project out more than about 6 feet or so. That was the idea. The problem is that we know that this thing exists in aerosol form. So aerosols are these very tiny droplets that can just kind of hang in the air. Imagine if you take a hot shower and you see that steam kind of hanging in the air. It's the same phenomenon. So, when you're indoors, you build up those aerosols. When you're outdoors, those aerosols can dissipate over time. But as you mentioned, when you have a bunch of people packed in together, that's a higher risk situation. A lot of the studies show that outdoor venues don't really cause big super spreader events. And that's certainly a reassuring thing going into the spring. Also, very honestly, with the Omicron variant, because we had these just ballooning case numbers, it's very hard to put a pin in exactly where those came from. So I think contact tracing broke down over the past couple months as well, because it's simply not feasible when the numbers are that high.
Yeah, it's interesting perspectives. And everyone talks about the winter. The last couple of years, we know those are some of the worst times. And we pray for a good spring when we can all get back out there. And a lot of people, they've been cooped up, and those who've been really socially isolating, they can't wait for the spring. Warren has a question for you, Dr. Skrzyynski. And if you're just joining us here on the Fox 2 YouTube channel, we're taking your questions right to Dr. Justin Skrzyynski at Beaumont. He's in and out of the COVID ward there. He knows exactly what's going on, has his hand on the pulse. Warren Price has a question. If you took the Johnson & Johnson, then had it a second time for a booster, what's next? Unfortunately, he goes on to say, the CDC told everyone a week after we took our second Johnson & Johnson to use a different one for a booster. So if you would answer his question, but also a little bit about Johnson & Johnson. I have a friend of mine who works here at Fox 2 every day, and he's like, how come no one's talking about the Johnson & Johnson? It seems like everyone talks about Moderna and Pfizer, but there's a lot of people who took that other shot. What do you tell Warren and the rest of the guys?
Yeah, well, that's, it's terrible timing, first of all. It's very unfortunate. And, there's a lot of, the messaging coming out from, CDC and other institutions, FDA, a lot of the times that can be very rapid fire. A lot of the times that can be even sometimes contradictory. And it's very difficult for us, even as professionals, to keep up on everything as rapidly as it's coming out. It's a very difficult ask for the non-medical person who's got an entire life's worth of social and professional obligations to keep up on that as well. So, with that said, the Johnson & Johnson, from the beginning, because remember, all of these vaccines were made against the original strain of COVID. So it's what we call the wild type COVID. So the one you find that's sort of out in nature, so to speak. It's all out in nature now. We're so far removed from that strain that, there's similarities between Omicron and the original COVID, but in many ways, it's almost a new virus at this point. So for instance, there's a new strain of Omicron that they call the stealth strain because PCR tests aren't picking it up. So, this thing is almost to the point where it's a brand new virus. That's a long way of saying that when you have the original vaccines, which were very effective, not only in preventing deaths, not only in preventing hospitalizations, but preventing symptomatic cases, we're so far removed from that the vaccine still provides benefit. Johnson & Johnson, we found that is not providing as significant of a benefit against the variant strains as it did against the original COVID. This is a problem with AstraZeneca. We don't hear about that here, but that one's used worldwide, same mechanism as Johnson & Johnson. So that's kind of a long-winded way of saying that Johnson & Johnson didn't really work against these previous variants the further you get from the original COVID. Now, if you've already had 2 doses of the Johnson & Johnson, so an original and a booster, again, the preference is if you've had the 1 dose, get boosted with Moderna or Pfizer. You've already had the Johnson & Johnson booster, I would say talk to your doctor about whether or not you need to get boosted with one of the mRNA vaccines, or if you need to start your series over, for instance. If you've had that Johnson & Johnson shot, though, the second one, that should be providing you good coverage. The problem is there's not enough data to say percents and such.
Oh, this is, we're getting questions from all over now. In fact, on the YouTube channel, we have a few of the viewers who are on there right now. I wanted to ask you one of their questions. Just Divine, that's not, I don't think, the person's name, but they have a very cool handle, Just Divine, saying, thanks for this segment. I got my Pfizer booster this past Wednesday. Do I have to wait a while to get my shingles vaccination? People are wondering about that, about this, I got this shot. What about my other ones?
Yeah. Right now, as far as the recommendation stands, there's no reason to delay necessarily. I would say that, because there are some side effects, feeling crummy just overall, the whole constellation of side effects you can have from the vaccine, unless it's an urgent thing to get another vaccine, you can always wait and postpone that a couple weeks. For instance, the time period that we say to sort of cement that immunity after a COVID shot is about 2 weeks. After that, things should have calmed down significantly with the immune system. So again, unless it's an urgency to get another vaccine, you can always put that off a couple weeks as well.
Not a bad idea. All right, we have another message, question coming in on our YouTube channel chat here from Felder. What's the deal with the vaccine? I hear they are working on the one that you put in your nose instead of the shot. We did hear about that for a little while, and I feel like it kind of faded away. What is going on with the nasal vaccination?
Yeah, excellent question. That's, one of those promising things coming up as well. So there's a returned interest to the intranasal vaccine. And one of the reasons for that, so previously you get the shot in the arm, essentially you've got this sort of source of this viral antigen, and you're making something the immune system can spot, react to. That way, if the actual virus shows up, your immune system knows what it is and can pounce on it. The thing with the Omicron variant is that Omicron, and that's actually one of the reasons why it causes less mortality. It's killing fewer people. But the Omicron variant is more in the upper airways. So previously you saw things like Delta, which was super aggressive, caused a lot of deaths. That's all these lower airway pneumonia kind of pictures. One of the ideas now in revisiting the nasal vaccines is that you introduce this antigen to the nasal passages to the upper airway. The idea is that you could possibly form a more preferential response in that area that could actually intercept and neutralize viral particles as they enter. So not only is it just an easier way to do it, I mean, you can just, a squirt up the nose is obviously much easier to administer than an injection, but also the idea that, it's sort of providing protection at the first port of entry of the virus, and that might help to intercept it better.
Yeah, I could name many big kids and little kids that would love to get the nasal vaccination versus, the shot for sure. That's not something that sounds like a lot of fun. But look, especially with these boosters, people saying, "Oh, I got to go back and get a booster." The nasal option would be something that people would probably love. Okay, let's talk about masks for a moment here. So I have this KN95 mask in my left hand. I have a cloth mask in my right hand, and people are confused about this. I mean, look, I think the CDC did come out and say that the K95 or KN95 masks are better, but are these cloth masks completely worthless, or should we still use them?
Yeah, so not completely worthless. And actually, I've got I've got my whole little show and tell here as well. And I'll kind of I'll walk you through in terms of increasing effectiveness. So at the bottom, you've got your cloth mask. Wherever you got them, if it's Etsy or a store or wherever it is that you bought your cloth mask, it should still provide some protection. And there's actually some information that just came out earlier today, actually, showing sort of the risk mitigation, risk reduction with the different mask types. So this one will still provide you with some protection. And the analogy that I would use is, if people say, well, surgical masks or cloth masks, they don't provide you with the same protection as an N95. Why bother? It's sort of like saying, well, it's really cold outside. All I've got is a spring jacket, so I might as well be naked. It's still some protection. It's still better than nothing, for sure. So you've got your cloth mask at the bottom. You've got your surgical mask, which is sort of the next step up from that. Very common. And then, as you mentioned, the KN95. And one of the important things about these is that these tend to fit the face better. That's one of the things that you see keep cropping up, is that phrase, a well-fitting mask. And so it's not necessarily just the material the mask is made of, but it's also the fact that it's going to be a better seal around the face, not only preventing particles from getting out, but also getting in. And then at the top of that, you've got your N95, which is what we use in the hospital, for instance. It's more expensive, and the downside to this is that most of the time these need to be fit tested as well. So in order for it to actually have a reliable seal, there's a fit testing process to make sure that you're sized appropriately. So, while these do provide the best protection, and they're certainly available much more frequently now to the general public, it's a matter of whether or not you know how to use it properly, that it's going to provide the most effect. So I think for the people that are most concerned, I think the KN95 is going to be your best bet, because it's more of a one-size-fits-all. It's a better material in terms of not letting any particles in or out, and it's probably going to give you a better seal around the face.
This is really interesting stuff. I think your metaphor about the coat situation was really well received, because I think you're saying, some protection is better than nothing. And if you're super, upset, or you're super vulnerable, and you just don't want to be outside without the proper protection, then you just go as far as you can go on the scale of those masks. I wanted to ask you this question from Anne. She says, I got 3 Pfizer vaccines and still got sick with COVID in January of 2022, this year. How common is that? And think about it. So she's gotten boosted. She's gotten her 2 shots. She's basically saying, look, I did everything right, and I still got sick. And so how common is that?
Unfortunately, it's incredibly common. And that gets to a little bit about what we talked about earlier on, where with Omicron, and especially the fact that you've got versions of Omicron that aren't even detectable by the PCR swabs. And that's not to be alarmist. It's just saying that it's so different from the original that some of the tests aren't even picking it up. This is almost a different virus. So it's saying that we made this vaccine, a couple of years ago now, which is crazy to think about, but we made this vaccine a couple of years ago, which was very effective at preventing not only hospitalization, not only deaths, but symptomatic infection. So the original COVID, yeah, these mRNA vaccines, if you had 2 shots of that, something like 95% protection against even a symptomatic infection. Now, various estimates with people who have gotten boosted with Omicron, you're looking at, in terms of preventing symptomatic infection, estimates anywhere from something like 30 to 60%. But one of the key things is that it seems like the vaccine is still keeping people out of the hospital and keeping people from dying. So if you look at the percentages, yes, still having a lot of breakthrough cases. And, it's an unfortunate thing that we've got Omicron now, which is so different. Because it's basically sort of a lock and key mechanism. So, if the vaccine is the key, if you keep changing the lock, eventually it's not going to work, or it's not going to work as well, or it takes some fiddling. It's the same phenomenon where you've got a vaccine made for what's almost a different virus at this point.
There's a lot of questions out there, and there's a lot of talk, I should say, out there about what this vaccine does to the body. And one person's asking the question on our YouTube channel, Adiron Dennis, basically saying that this person believes it's a fact that if you keep getting vaccinated, it'll somehow mess with your immune system. When you hear things like that, how do you address that, Dr. Skrzyynski?
Well, first off, I don't think that's true. The problem is that there's so much speculation, and people can throw out a lot of fancy terminology. And the problem is that if you look at the actual mechanism of how it works, we've gotten vaccinations all of our lives. You look at other shots, flu shot is an annual shot. If, people have been immunized against hepatitis B, that's a 3-shot series. So, there's many vaccines where you'll have multiple shots over time, tetanus, that sort of thing. The idea that somehow it's going to cause autoimmune diseases, there's this whole idea of infertility, which people say is autoimmune mediated, that hasn't borne out yet. And in the initial studies, Pfizer, for instance, you have something like 30 to 40,000 people in the initial study. We don't see any of those effects following those people this far out. And now you've got a sample size of, over 100 million in this country who've received the vaccine. And we still don't see those things bear out. So, there's always the, maybe this, maybe that, maybe 5 years down the line, maybe 10 years down the line. But at the same time, we know for a fact that this vaccine prevents deaths and hospitalizations. And we know for a fact that almost 900,000 people have already died from COVID right now, based on everything we know. And also looking at the physiology, the mechanism of how this vaccine functions, we don't see that as causing long-term effects. And we don't see that as certainly the risks outweighing any benefits that we're seeing now.
If you're just joining us, we're talking to Dr. Justin Skrzyynski with Beaumont. He's answering your questions right now about COVID-19, the vaccine, Omicron. We want to take your questions, your concerns, and take them right to the doctor. And that's what we're doing right now. In fact, Mark has one question for you that I think is interesting. You hear a lot about the COVID variants, Delta and Omicron. Whatever happened to the original version? Is it still active or not? Is it still around, Dr. Skrzyynski?
Probably not, is the short answer. Right now, so for instance, one of the things that's a little bit frustrating, but again, the problem is having the apparatus to actually do what we call serotyping or genomic testing and saying which variant is which. That's not available on the local level. So for instance, in the hospital and everywhere in the state, a sample of positive tests is sent off to the state. They do this genotyping. They figure out, okay, it's this percent Omicron, this percent Delta, et cetera. They release those numbers for the state or the region. Unfortunately, we don't hear back and say, well, Mr. Smith has Omicron, Mrs. Jones has Delta. Unfortunately, we don't hear back about that at an individual level. What happens, though, is that, as the virus spreads, you have these much more contagious variants. So Omicron, many times more contagious than Delta, which was already many more times contagious than the original COVID. So if you imagine the virus has to do this sort of leapfrog thing because it's only going to be viable in your body for, maybe 2 weeks, upwards of 20 days for the people who are really sick. But the idea is that before your body sort of purges it out, it's got to spread to another host. And the more contagious variants, so Delta, Omicron, et cetera, they're going to be able to do that leapfrog act a lot better than the original ones. So eventually the original strains, and you hear about Alpha and that sort of thing, those get basically outcompeted. So right now it's predominantly Omicron because it's so contagious. It's something like, I believe in the state, I want to say something like 99%, but you do have some residual Delta cases in there as well.
We have Roberto asking the question, why are they giving out the vaccines when we have a monoclonal antibody shot? When you think about the antibody shot that is out there, there are people out there who are vaccine hesitant, who are wondering why get the shot when if you get COVID, you can just go get treated for it.
Well, the short answer is that the treatments are only partially effective. And first off, the monoclonal antibodies, this is an enormously controversial issue, but FDA actually withdrew approval for some of the monoclonal antibodies, or withdrew recommendation. The idea is it's the same thing with the vaccine, is that it's basically a lock and key mechanism, and that the monoclonal antibodies were made against the original strain of COVID. And now that you have Omicron, it's so different. These monoclonal antibodies, basically the target that they're designed for, is so mutated that they don't work anymore. So monoclonal antibodies, I'm trying to remember, I believe there's only one product that still has its approval, but they're not going to be very effective against Omicron. You think about medications like Paxlovid, that's the COVID pill everyone talks about. That's only effective if you take it in the first few days of symptoms. It's very easy to miss that window because it's very vague symptoms, cough or fever or congestion. Somebody might pass that off as allergies if we get one of these days when all the snow melts. So it's very hard to catch that in the right time frame. The real point is, and I've had this conversation, unfortunately, many times over with my patients at the hospital, there's no cure for COVID. Once things progress to this big inflammatory storm, which is really what kills people, there's little to do except steroids and anti-inflammatory medications and try and support them as much as possible otherwise. So the idea is that the one thing that we know for sure is going to keep people out of the hospital, keep people from dying, is vaccination. And it's to have been vaccinated completely by the time you're exposed to COVID. So to say, well, I don't need the vaccine because there are these treatments coming out, the treatments are good if they're used in the right capacity at the right time. But again, very easy to miss that window. And once you're past that, there's nothing you can do except roll the dice and you make it or you don't, very honestly.
Yeah, not a gamble that a lot of people want to take necessarily, and that's why you have people who've gotten the vaccine. But this next question is from Adam, and it has to do with those who are vaccinated versus those who are unvaccinated. And I say versus because it seems as though the two groups had been and have been put kind of up against each other. Adam's saying if the vaccine lessens symptoms but doesn't keep someone from contracting or transmitting it to others, then how exactly are the unvaccinated people more of a threat than those who are vaccinated?
Yeah. And earlier on, I would have given you a different answer. If you go back a year, I would say, well, transmission is significantly less with vaccinated people than it is with unvaccinated. But right now, that's not necessarily the case. We know that people who are vaccinated can still contract Omicron. It seems that they can still transmit Omicron. I don't have any data in front of me in terms of how much they can transmit, but my guess would be that it's at least a slight reduction from unvaccinated. So the idea that you get vaccinated for your neighbor doesn't pan out to the extent that it necessarily did before. However, the reason why you'd still get vaccinated for your neighbor is because the healthcare system can't keep doing this. That's one of the reasons. The hospitals are still reeling. I work at one, and these are things that I see with my two eyes. This is not trying to be sensationalist or alarmist. This is just what I see on a daily basis, is that the hospital system is stretched amazingly thin. Now, going back to the beginning, everyone kept saying, well, where are all the other sick people? Why do we only hear about COVID? Excellent question. Where were all the sick people? It turns out they were at home getting sicker. So one of the priorities now is that we're trying to keep hospitalizations down. We don't care so much about community numbers if people aren't getting too terribly sick. Let's say we get to a point down the road where you've got a COVID that's basically a common cold. Do we care about numbers at that point? Do we care about testing at that point? Not especially. But the problem is that it's still filling up hospitals. It's still killing a couple thousand people a day. So in terms of, why get vaccinated, first off, it's to preserve the hospital system, because that's sort of the civic responsibility in getting vaccinated. But also it's going to keep you from being hospitalized. It's going to keep you from dying. Again, is it going to prevent all the symptomatic infections? Not really. But at the same time, we do know that it's got a strong reduction in terms of mortality.
But that whole scenario that people had before Omicron, which was inviting people only who were vaccinated to their homes, and not allowing people who are unvaccinated to come in or come close to them, that doesn't apply with Omicron anymore, is what I'm hearing you say.
Short answer is yes. And it's, you mentioned it yourself. It's very fascinating now that it's almost like ethnicities. You have the vaccinated and the unvaccinated, and it's such an oddly polarized thing,
Yeah.
But at the same time, in terms of what's going to prevent the spread of Omicron, it's the things that unfortunately a lot of people don't really want to return to, which is either staying home or wearing masks. So the most effective thing, again, if you want to prevent people from dying on an individual level, then absolutely vaccination is amazingly important. But in terms of preventing that spread, if you're standing next to somebody, one of the biggest things is going to be, again, staying home if you have any concern, if you've had any exposure, and then also masking up.
I wanted to ask you this question from Sean. He's saying, why isn't there more of a conversation talking about natural immunity? You hear often from people, especially those who are unvaccinated, who will say, if everyone just got sick with this and got it, then we'd have natural immunity. I know from a doctor's perspective, you don't want to fill up ERs with people and overwhelm the system and have people lose their lives. But when it comes to natural immunity, how much credence should we give to that still being something that's strong and that can help people fight this?
Yeah. And first off, there isn't as much data as you'd like. And there's reasons for that. And I think a lot of people will immediately say, well, there's a bias because people are trying to shunt the population into being vaccinated. So we're trying to downplay either the importance or the effectiveness of natural immunity. Omicron changes things for a couple of reasons. One, it's less deadly. The idea of achieving, that mythical herd immunity through just allowing the virus to spread throughout the population. I mean, that was a suicidal notion with previous variants. If you look at the Delta variant, amazingly high mortality. Essentially, you would have well over 1 million people, probably a couple million people dead in the US if from the beginning we said we're just going to go about business as usual and not have any measures whatsoever. So, the idea of herd immunity through exposure, previous variants, definitely out of the question. Also, with the Omicron variant, because it's so much more contagious, because so many people are getting it, because there's so many breakthrough infections, and because it is less deadly, we're going to see a lot of people who have that exposure, got better, and then now are going to have a immunity moving forward. Again, we know the vaccines are somewhat effective against Omicron, but again, especially with Omicron, that's going to be an area for further research because of the fact that, not everybody, but so many people had gotten that.
Anne is on our YouTube channel streaming right now. She has a question, which I think you've partially answered on our air on Fox 2, but I wanted to get this out into the limelight again, this topic. How close is the world to being done with the pandemic and entering an endemic with manageable treatment? I keep hearing from different people that we're entering the endemic. First of all, what is an endemic for those who aren't familiar, and are we there yet?
So we're not there yet. And what we're looking at is we think about, flu is always the classic counterexample to COVID. So we say, well, every year we have X number of flu cases. The number typically is something like 40 to 60,000 flu deaths per year. And people point to that and say, well, we accepted that when we had, before. Now, again, our flu cases are low for various reasons, but before influenza killed 40 to 60,000 people a year, we accepted that as the cost of doing business and the cost of being around each other running the risk of transmissible disease. So endemic means it just kind of circulates in the population. It's there. We're not going to try to stamp it out or eradicate it. It just kind of happens. We're not there yet because, again, you got to remember, COVID's still killing something like 2,000 people a day. So if you look at the mortality from COVID versus something like flu, it's still amazingly high. So a lot of people want to believe, well, Omicron's here, everyone's going to get it, we're going to have herd immunity, done with the pandemic, I might as well go out and get sick. No, I mean, you still have a couple thousand people a day dying, which is very much glossed over. Now, in terms of what are our criteria for saying that the pandemic is over? That's something we have to define as a society. So what number of deaths is going to be acceptable to us? What burden on the healthcare system is going to be acceptable to us? Because every death is a loss. That's a family that lost a loved one too. It's not so simple as saying, well, it's low, we're okay with it. I can tell you right now, the mortality is just way too high. But let's say that COVID does shift towards being a less deadly version of itself, which is what we hope it will do. If that happens, then, let's say we do have annual COVID mortality in the order of flus, 40 to 60,000 cases. If we as a society are okay accepting that as, again, the cost of doing business, then we can say, yeah, it's just there. It's going to kill a certain amount of people a year. We'll do our best, and we want to keep the doors open.
All right, so let's talk about that Omicron right now. You and I have talked about this in the past. I know there's initial information that doctors are getting that you wouldn't go on TV with just yet. And I understand that you're not saying anything officially on the books in terms of what is absolutely the case. But does Omicron, in your mind, does it appear to be COVID's last stand?
I would like to think so. And the reason why is, first off, it's inoculating a huge amount of the population. The protection from natural immunity, again, poorly studied relative to vaccine protection, but it's something. And reinfection, at least within the first something like 3 to 6 months, is fairly low. So the idea is that, if you have a huge segment of the population which is infected by Omicron, and then also a huge segment of the population that's vaccinated, Omicron can't do this sort of leapfrog act where it jumps person to person, and then eventually you'd see those numbers die out. Because you've got so many people who have some form of protection against it, it reduces those jumps that Omicron can make, eventually kind of hits these dead ends, and then it goes away. So right now, in order to create another surge, you would need to have a variant which is significantly different than Omicron. So for instance, Omicron compared to Delta, significantly different. It's got a lot of different mutations. It's a lot more contagious. That's why the therapeutics that worked for Delta don't necessarily work against Omicron, but that's also why Omicron was able to make these exploding case numbers. So in order to have another surge of COVID, you would have to have either pockets that were never exposed to Omicron that suddenly become exposed, or you'd have to have a variant which is so different that the immunity that so many people have now is not going to be is not going to be able to protect them, and they'll still get sick. So my hope is, without seeing that variant, and remember how fast Omicron burst on the scene, it was something like a month between it when it was a variant of concern and when it was the dominant strain. These things can happen quickly, but my hope is that we don't see that big mutation, we don't see that new variant, and that we'll see Omicron burn out and hopefully have a COVID-free spring and summer.
Are there enough people who've had Omicron now that could be a possibility because of that?
Yeah, that's a very real possibility, actually. Again, if you look at the graphs, for instance, the various graphs of things like case numbers, percent positivity, all that kind of stuff. I mean, it's the Omicron surge dwarfs the previous couple that we had. I mean, it's numbers that we hadn't seen since the very beginning of the pandemic. And again, that gets to the fact that Omicron is so different. It's almost a new virus at this point. So if you think about when COVID hit this otherwise unexposed population, this naive population, and how rapidly it was able to spread, Omicron did the same thing because no one really had good immunity against it. So, in terms of how many people are exposed, and again, the vaccination does count for something. It's not to say that that's useless against Omicron. That does count for something too. So my hope is that there's enough immunity in the community as a whole that we see this thing burn itself out.
So interesting. Samantha is asking a question here that I wanted to ask you as well about the number of people who are actually vaccinated in the ERs and the people who are not vaccinated. I know, at first it was a lower number, and then we heard a higher number. What is it? Like, for instance, today at Beaumont, would you say the percentage?
Yeah, right now the numbers that I'm working off are the ones that are from about a week ago or so. But again, considering it's Omicron, my assumption is that they probably shouldn't change too much. We were seeing something on the order of about 50 to 60% unvaccinated. And then, the other 40% would be vaccinated and boosted. The key thing is that once you get into the boosted population, that's single digits in terms of population. So under 10% of all these patients are boosted. So a good number of breakthrough cases. I will say as well that it's important to note, once you get into the higher levels of care, sicker patients, ICU patients, and unfortunately our patients that die, many, many more of them. So we're talking something like 70 to 80% of those are unvaccinated. So as you get to the more severe cases, fewer breakthroughs. So again, the vaccine may not be preventing symptomatic infection, but it's certainly helping to mitigate death.
So, like today, for instance, in your ER, would you call things today? I know it changes every day. Is it under control today?
Yes, it is under control today. And, I will say that our COVID numbers are down dramatically, actually. If you look at, for instance, at the peak, we had, and these are the numbers for Beaumont Royal Oak. We had something like maybe, I would say, 250 COVID patients in the hospital. And this is a 1,000-bed hospital. So that's a huge proportion of the hospital. These were numbers that were not necessarily approaching our first surge, but it was very concerning. We had to close down a lot of units in order to make those into COVID floors. We had these staggering wait times in the ER because we were just being mobbed. So compared to that, right now the last numbers I saw were under 100 COVID patients in the hospital. So it's a huge reduction in that population in terms of how many people are hitting the ERs. That gives us a lot of respite because unfortunately you hear it time and time again, but the staffing crisis in all of
Yeah.
healthcare, not just Beaumont, but nationally, is still there too.
David Sills is saying, "Hey, Roop, I have a question. If the half dose or the booster only lasts 3 months, why don't they give a full third dose instead of the booster, which may last 6 months?"
Well, honestly, I'd have to take a look at the numbers for that 3 month data. The thing is that if you look at the original sort of cohort of people, so I got my second shot at the beginning of January so just about over a year ago. So I was one of the first people to get a booster, and even then, that's only 6 months ago. So I would wait and see more data in terms of how long that protection is lasting. Because again, it's not so much that you've got this giant surge of patients, or I'm sorry, this giant population like you had with the initial vaccinated population that you can track. It's more that people kind of trickled into the booster phase of things. So I would wait and see more information. Also, again, it's not to belabor the point, but Omicron is so different from the original COVID that you're just not going to see the same protection that you did from the original strain.
Good stuff. Mari Wilson is asking a question. We've all taken precautions, all vax boosted. We wear our masks, only associate with friends and family who do the same, eat at outside places, carry out, no shows, no movies, no festivals, no flights, no crowds. Why does it seem like so many people are flying places, traveling, and don't get sick?
Some of it's luck of the draw, some of it's asymptomatic infection. Honestly, I've seen some bizarre things with COVID. I've seen patients where they were the only infected person in a crowded household. I've seen patients where they'll tell me about one family member who's the only non-infected person in a crowded household. So a lot of the times it's luck of the draw. Again, this is a statistic that a lot of people like to throw around online, for instance. This makes it into a lot of the memes and such. But the vast majority of COVID patients can successfully recover at home. There's a large percent of asymptomatic cases. The problem is that it's just deadly enough to end up with the unfortunate numbers that we see of all the people who tragically died. So the people who seem to get away with everything, either A, they were sick, they didn't know about it, B, they were sick, they didn't tell you, or C, they were just very lucky.
Interesting stuff. Timothy Cheek has a question that's been echoed by many of our Fox 2 viewers about health in general when it comes to warding off COVID. Is it true that the best defense from getting sick is to build a stronger immune system by eating the right foods and getting plenty of exercise? And, there are many people in the holistic world who you see on social media and online who say, man, I wish the doctors would talk about this because it's very effective in warding off COVID. Dr. Skrzyynski, what do you tell people about how effective that is?
Well, the best defense is to have been healthy by the time you got exposed to COVID, which is a big ask. So, let's break this down real quick. Why aren't we saying, well, get in shape, get your medical conditions under control. Make sure that you've got a supported immune system, make sure your diet's cleaned up, lose that weight. These are things that we say for a lot of conditions. Look at the numbers of people that die from heart disease every year. Look at the number of people that die from smoking related complications every year. The advice is out there, and I'm not going to comment about how effective that counseling is. So I'm not saying, well, it's just that people don't listen to their doctor. I'm not commenting on that. But I am saying is that there are a lot of diseases already where lifestyle saves lives. And it's not an easy thing to implement. So if you have a patient that says, well, doc, I don't want to take the vaccine. What if I was just a healthy guy? What if I just made myself healthier and had a good immune system? Well, first off, I've seen my share of young, healthy guys who have ended up on ventilators and unfortunately passed away. I've seen that. Not very common. I'll be very honest. It's a small segment of the people that I take care of, but it still happens. So, this virus can come for anybody. The second answer is it's not an easy thing. It's just say, okay, well, drop 60 pounds and get your blood pressure under control. That's not a rapid thing that you can do. And if you're looking at the protection that you get from a vaccine series where you're fully vaccinated within, let's say, maybe 6 weeks or so, even including the time after your second shot, 6 weeks to have somebody fully vaccinated versus months or years to get somebody who's very motivated, very dedicated, and they're committed to losing the weight and getting into shape. So you can see why one solution is going to be effective much more in the short term versus another solution, which honestly, we've been advocating for a variety of health conditions, not just COVID, which meets with very mixed success.
Let's talk about the flu for a moment, because the comparison from, especially, again, it seems like this is such a divide because you have people just like seems like with religion, with class, and yes, with vaccine or no vaccine, it seems to be kind of the name of the game here. But when you have people say things like people die from the flu every year, why aren't we talking about that as much? Are we at a level of numbers today where it's comparable to an average year when it comes to flu hospitalizations?
Well, I can tell you right now, it's significantly more. If you look at right now, again, fortunately, it's coming down. But for instance, since New Year's, let's not even take last year, but since New Year's, I don't have the numbers in front of me, but I can tell you right now, we never filled up the hospital with flu patients. In terms of will COVID get to the point where it is going to be this endemic virus where it's going to circulate, it may not kill many people, but at the same time it's there. My hope is yes, that is the trend that a lot of viruses do have. But to say, well, why don't we focus on the flu cases? To me, that's a bit of a non sequitur. That's like saying, well, X number of people die of heart attacks. Well, why don't we care about lung cancer? I mean, these are two different issues, two different viruses. And in this case with COVID, that is the priority, that is the urgency. So for those who perceive that there's an emphasis taken off of other illnesses or that other illnesses are downplayed, the priority is this. If your house is on fire, you're less concerned about the landscaping. There's a priority to do right now. Now, moving forward, again, if we see that our COVID numbers, our COVID hospitalizations and deaths in particular are coming down to the level that we used to see with flu, maybe that's the time that we say, maybe it's not worth testing anymore. Maybe it's not worth quarantining anymore because we've already accepted this level of mortality and COVID is not exceeding that threshold.
Samantha has a question about masking, about who it protects. She's saying, is it true that the face masks do not prevent you from getting COVID, but actually lower the chance of you spreading it? That has been something that a lot of people have been asking. Is this for me or is this for somebody else? Them asking if I go, for instance, to the grocery store.
Well, in a word, it's both. In a word, it's both. So again, like we discussed before, and if you have something like the KN95 mask, so this is it's a high quality material, it seals well onto the face. That's going to help both ways, because you can imagine that if you're breathing out with a surgical mask, you've got a lot of air blowing out sideways from around the mask. You're breathing in, you've got a lot of air this way. It's going to prevent a lot of droplets. So kind of the larger particles of fluid that can carry the virus, that's going to get caught in a surgical or a cloth mask. So that's going to help with transmission. If you want to protect yourself, again, tight fitting mask, high quality material, so like a KN95, or if you know how to use one, an N95. So again, with the less expensive or the less quality masks, that's going to be more for a transmission protection. But it still should provide some mitigation for both.
Jeff has a question. We got two more questions for you. Jeff is asking, do you believe that we'll be getting the COVID vaccines for the foreseeable future, perhaps for good?
Excellent question. And the short answer, I would not see necessarily more than an annual COVID shot. I think it might be something like a flu shot. Again, that depends how this virus progresses. If we see COVID just fade back into the other coronaviruses, because coronaviruses, with some exceptions, namely COVID, but also things like SARS, MERS, things people might have heard about, coronaviruses are typically cold viruses. There's hundreds of them out there. And we don't vaccinate against them. We don't test against them. If COVID goes that way, what's the point of vaccinating against the common cold? Because, you might vaccinate against one strain. There's a million more out there. There's some interesting information now, and this is from one of the European health agencies. They're actually advising that you probably don't want to over-vaccinate because the last thing you want to do is desensitize the immune system through repeated exposures to something like COVID. So I think you'd probably see at most an annual COVID shot moving forward, but even that remains to be seen depending on how the virus sort of evolves over time.
Last question for you. And by the way, Dr. Skrzyynski, you've been so generous with your time today. And so many people, of course, tuned in as this is live, but many other people are watching this on a replay because they wanted to hear perhaps their questions answered. And because of your time today, we've been able to kind of take a long form, good hour to talk about this. And as wrapping up your take for this afternoon. And she's asking, which is the strongest vaccine? Can I get a booster with that one if it's not the one I originally got vaccinated for? I know there's a lot of people paying attention to that because after the fact they say, man, I wish I had that other shot.
Right now, I would hold Pfizer and Moderna to be about equivalent. So for instance, I got Pfizer. I know I have many friends who got Moderna. If you look at the data, there's going to be some pluses and minuses here and there. But honestly, overall, especially if you look at how they work and you look at the numbers in terms of the protection they provide, should be about the same. So if you initially got your vaccination series with one, you should be able to complete that with the vaccine of your choice, actually. So again, the recommendation is one of those two, Pfizer or Moderna. And we were talking about Johnson & Johnson earlier, which is a bit more of a complex issue. But if you got one of the mRNA vaccines, so one of the two-shot vaccines, you can complete it with either of the mRNA vaccines.
All right, we have a lot of people saying thank you to you as well. Groovy Grape Grandma. I love the names on this, on some of the YouTube channel here, but she says, thank you for the answer. Samantha says, thank you for this live chat. It helps a lot. Have a nice weekend. And I think it's safe to say from all of us at Fox 2 and our thousands of viewers who watch every day and, of course, online as well, we appreciate your time today because it's been so helpful. Dr. Skrzyynski, I hope you'll come back and we can do this again sometime really soon. People have a lot of questions and you have some great answers and you explain it in a way that people really don't have a hard time understanding, which is awesome.
Well, thank you. And thank you for giving us the platform to discuss these things. It's not often you get the time to actually go through the answers in depth. And especially this whole pandemic has been about communication. So we're always really deeply appreciative for the chance to do this.
By the way, Groovy Grandma says, sorry for the trolls as well. Look, you're on a digital space. People are going to say what they want to say. We wanted to make sure that We fact-checked everything. We went through you. We talked to you about everything that you were able to discuss. Thank you for your time today. Dr. Justin Skrzyynski with Beaumont. We'll see you on television, on the evening news, and of course, we'll see you back here, right here on the Fox 2 YouTube channel as well. Have a great day.
You too. Thank you again.
Thank you.